as I had mentioned before, you can have acute inflammation, which is, you cut yourself, your body responds with inflammation. The area turns red. It's not necessarily infected, but it's starting to create an immune response that is, it's red, it's hot, it's painful. You might have some swelling. All of these characteristics, which we're taught to follow in medical school. And, I still will make notes in my charts about, do they have positive calor, tumor, rubor, dolor, and I actually use those exact words whenever I'm speaking about a skin site on a patient, whether it's an infection or not. These are historically called your cardinal signs of inflammation. And they date back thousands of years of how the first inflammatory or infection responses were being marked or followed. That's very different from chronic inflammation, which is what we had also mentioned is almost like your microinflammation. This is subclinical, and that's really what's contributed to the aging process. What you're using as a marker, so if I were to order a blood test for a patient, I would be ordering what's called a C-reactive protein level. And anytime I have a patient that's not responding to medications, or they have a lot of joint pain, they have, excessive nerve irritation, I start thinking about they're having almost like an autoimmune response, where we'll speak a little bit about neurogenic inflammation, which is an immune response. And anytime you have an immune response, there's always an associated inflammatory response. Anytime there's an associated inflammatory response, there's an associated nerve response, like a peripheral nerve response, and almost like a neovascularization response. So if I have a patient like that, I will order a blood test and look at what's called their C-reactive protein. You can also look at what's called the ESR, which is another marker of inflammation. If we look specifically at CRP, just to understand this a little bit more, it is a biomarker of inflammation, and it actually upregulates the interleukin-6. So if you remember that I had said that that's the cytokine that is released during this inflammatory cascade. So it feeds the inflammatory response, an autoimmune response in some cases, and then can definitely be associated with age-related diseases. So understanding what CRP is very important. If you have a client that you think has a high inflammatory levels, you can ask them to go to their doctor and get a CRP test, and that would help you kind of gauge their inflammatory level. Redox stress, if you remember that this is the reactive oxygen species, and this is related to the autooxidation of glucose. In many cases can do that. It's forming a free radical outside of the brain. The other area of the body that's the most responsible for creating ROS, or reactive oxygen species, is the mitochondria. And again, that has to do with the fact that the mitochondria is your kind of muscle of your cell, and there is something that's called the mitochondrial free radical theory of aging, which means that if you want to decrease your oxidative stress, you need to somehow decrease your mitochondrial activity. And which I understand from a movement perspective, if you decrease mitochondrial activity, that's going to decrease your energy, because part of endurance training is you'll actually see an increase in mitochondrial formation and proliferation, that you actually increase your total number of mitochondria when you do endurance training, cardiovascular training, etc. Just know that the more you use your mitochondria, you are actually increasing your number of oxidative, or your level of oxidative stress. If that's the case, you being movement specialists, you need to counter that by understanding that exercise creates an acute oxidative stress on the body. So anytime that I work out, and when I would work with clients on working out, part of their post workout regimen would be a high level of antioxidants to combat that acute increase in oxidative stress, which is a result from the mitochondrial, from the activity. So this is a way that you can kind of blend that in as well. Outside of antioxidants, you can decrease your total mitochondrial activity, which is going to decrease your oxidative stress levels through our biohack number 1, which is calorie restriction. So calorie restriction, if you were going to implement this with yourself or with your clients, you're essentially decreasing your total calorie intake by 20 to 40%. And this is based off your recommended total calorie intake versus what you're actually taking in. So if you're taking in 5,000 calories and you decrease that by 20 to 40%, you're clearly not on a true calorie restriction diet. When you look at the research around calorie restriction, it's very supportive. It's actually one of the best anti-aging strategies out there. And people who are hardcore into longevity, most of them are doing a calorie restriction type diet. What the research shows is that you have a decrease in the mitochondrial flow and decreased reactive oxygen species formation from the mitochondria. They're seeing decreased oxygen consumption and, again, total inflammation or inflammatory levels are going to be lower. It's something that's very difficult to maintain, obviously, for a long-term perspective, because having that little intake of calories is going to obviously affect your energy because you're using your mitochondria less, and that's your energy workhorse. So when people start to get fatigued, there's another side of vitamin supplementation that actually stimulates your mitochondria. So it's really a balance. Do you want the energy or do you want to decrease your mitochondrial activity? If you don't want to do the true calorie restriction, what you can do is take resveratrol. And this is the active ingredient of red wine. So this is why people tout and say that red wine is anti-aging and it's good for you and all that good stuff. And that's because it has the resveratrol. And what they've seen is that a lot of the research around this supplement is that it's the best supplement that mimics calorie restriction.